Any idea what do the uninsured do for health problems? I'm serious, and I asked that question because it seems to me that would be another selling point if people had an option that would pay for medical services. That would mean 45 million people are now paying into a system to get medical services that they weren't doing before. I haven't heard that.
Well, in many states, unfortunately not all, and it's being reduced, we have charity care, where those individuals who don't have any access to coverage walk into an emergency room. But you walk into an emergency room when you are in dire need, when that foot's about to fall off, you know, when your hypertension is to the point where you've had a stroke. Right. And so what we find by not having that health coverage, we don't have preventive care. And that is one of the worst situations right now, especially for children. Statistics coming from the White House: children without insurance have decreased access to child care, immunizations, basic dental services. We had a situation 2 to 3 years ago in Florida where a child died because of an abscess. An abscess.
That's a people problem. That's how the Republicans look at it, and that's it. But we're going to take a break and come back to that, because I'm in my simplistic mind, I'm thinking the more people with health insurance, the more people are going to use it for preventable checkups, first stage illnesses, etc.
Yes.
I don't know.
But you're thinking logically. I want you to stop.
Logic is my downfall. Let's take a break. We're coming right back.
AME Recovery is here to return our customers to their pre-catastrophe conditions as quickly as possible at a competitive price. When a disaster ends, our work begins. We pride ourselves on timely customer response. Each contact is prioritized from start to finish. We're experts at providing instant restoration response from all disasters: fires, storms, or water damage. Call our 24-hour hotline at 1-800-458-0693. AME Recovery. When a disaster ends, our work begins.
Welcome back to Table Talk. Paul Beaulieu, Blayne, Bondy, Tracie, Washington. Healthcare reform. We've heard about public options. What are the benefits of the public having an option? I mean, what's real to them?
Well, I'm going to quote the White House. They sum it up great. It must lower skyrocketing costs of health care, guarantee choice of doctors, and ensure quality, affordable health care. I think that sums it up. And that's really what people want. They want to make sure that, they have quality, they're not limited in options, and they want to make sure if something happens to them, they have coverage no matter what. And that's one of the big problems with the current way that the health insurance companies do their business. If you have a lifetime cap, well, when you might need it most, you can't get it because you've been capped out. And guess what? They don't send you an annual statement or monthly statement saying, hey, Paul Beaulieu, guess what? You're getting close. Don't get sick. But, but seriously, that's what people, and that's really one of the hardest, the issue that hits home the most. How many people have had to deal with a relative who has been capped out? How many people have had to deal with a relative who's had a pre-existing condition and couldn't get health? The stress of those issues alone are enough to drive anybody
crazy. It's capped out thing to me. I'm missing that. I mean, there's situations where, like, you got all your points. You can't get any more points.
Yeah, yes. There's lifetime caps on almost every policy, and if you get and where you really see it a lot is, say, if like a kid has leukemia or something, and they have to have reoccurring surgeries through, from the time this kid is born till however long it takes, which could be 20 years of surgeries. They oftentimes get capped out, and they will not receive, as long as their parent is insured by that insurance company. They're not eligible for any more benefits, and you don't get them onto the charity systems.
Forces them on the charity system, and you don't get to switch over from mom to dad, especially when you have this sort of pre-existing condition deal. But more importantly, in my assessment, when you have this public option, what President Obama, and many are hoping, is that we remove so many of these individuals from non-insured, which is an incredible tax and burden to the United States budget because of this charity health and all of folks hitting our emergency room when they are in dire need of medical conditions, and so the costs are astronomical, to a point where we can do more preventive care. If we get these individuals insured, we understand that we can do preventive care on obesity. For those individuals who are suffering, and goodness knows New Orleans is not immune to that label, suffering from obesity, we get that taken care of. Cancer, we get that taken care of. We get folks in there. You get the diagnostic examination every year for breast cancer. So we're not seeing you at the hospital when this cancer has metastasized, and so we can't do anything about it. And so it is our ability to get to preventive care that on the back end, and we know it won't happen next year or the year after, but on the tail end, reduce health costs. What we know, Paul, is that when health care is 1/6, as they've indicated, of our economy,
soon to be 1/5.
Soon to be 1/5. We cannot continue. It will bankrupt our system, and the only way we can take care of this is through the preventive care. That's absolutely it. And
people need insurance to do that.
And you've got to have insurance. And we know, as we've talked about before, this escalating cost for private insurance and for the small business owner. I'm a small business owner. To be able to say, even covering young folks, as I'm trying to do it, I got the quotes from Blue Cross and Blue Shield, and I said, somebody, get me the paddles. Get me the paddles. It's a crying shame.
Is President Obama playing tough enough? I mean, this issue has been in the forefront for weeks and weeks.
No. He has not played to the level of his opponents. As we said earlier, the message that the Republicans are getting out is a false message most of the time, but they're getting out with it. They're beating their falsities, their lies are making headlines. So at the end of the day, he's not playing hard enough. He needs to play hardball. And as Tracie said, he needs to get back to his roots. Where he was brilliant at was on the campaign trail. He needs to roll up his sleeves, lose the tie and the jacket, and get out there and sell this where the same methods that he used elected, he needs to use to get health care reform. He needs to make sure that he goes to those small towns where he knows he needs to get in the heart, the beltway of America, the heartbeat of America, and let these people know that we're not trying to socialize this. We're not trying to take away your benefits. We're not trying to force things on you that you don't want. But that's where he's good. That's where he's great. That's what he needs to get to.
Will it pass and when?
It will pass if they...
Because the media, the media is saying agenda largely undone. Go ahead, I'm sorry.
Once again, I'm tickled by these folks who think, if he doesn't get health care covered, then, the rest of the presidency is over. What black man wouldn't want 3.5 years of $400,000 a year to do nothing? No, we will get health care reform taken care of, and he will have something to do for the next 3.5 years.
Blayne, Tracie, thank you so much for being with us. Who knows, this may be our subject again next week. It's hot, it's vital, it's important. Thank you for joining us on Table Talk.